Cherry. So we have
Hello.
your presentation. I will tell you when the presentation is ready, and you can just tell us when you want to move to the next slide.
Ready.
Okay?
Perfect. Thank you so much, Laurence.
We hear you. Thank you, Cherry.
Great, perfect. So I'll start now if we can see my presentation.
Yes.
Yes, perfect. Thank you so much. So good afternoon, everyone. My name is Cherry, and I'm one of the incoming dermatology residents in London. Today, it's a pleasure to be presenting a comparison on the Cochrane ROB1 and ROB2 tools using the data from our living systematic review on psoriasis. Next slide. Next slide, please. Thank you so much. So systematic reviews heavily rely on accurate risk of bias assessments, and ROB2 was introduced to further improve from ROB1 using standardization and clarity, using structured domain and signaling questions. Our main aims with this project were to assess the inter-rater reliability of ROB1 and ROB2 and compare the overall judgments between ROB1 and ROB2, particularly for the primary efficacy outcome. We also evaluated how these differences affected sensitivity analysis in our Cochrane network meta-analysis, and this protocol was pre-registered on the open science framework. This was a fantastic opportunity to do some work, especially with regards to the serious adverse effects in the changes of the analysis, and the first update in 2017, regularly updated since then, where we've reanalyzed for the ROB2 changes for all the previous studies to make it very clear for our Cochrane review. Next slide, please. So we included randomized controlled trials in adults with moderate to severe psoriasis, and we focused on two outcomes mainly, the PASI 19, which represents a 90% improvement in psoriasis severity, as well as the serious adverse effects, or the SAEs as we call it. We used ROB1 for the 2023 update and the ROB2 for the 2025 update, with statistical method analysis, including the Cohen's kappa to assess for inter-rater reliability, as well as the Stewart-Maxwell's and the Boker test to compare the pair judgment across all the tools. Next slide, please. So we assess inter-rater reliability using Cohen's kappa, as I mentioned, for PASI 19. You can see the overall agreement was fair with a kappa of 0.37, while the serious adverse effects was moderate with 0.46. Looking at the domains, we see domain 1 and 4, which showed substantial agreement, while domains such as missing data, domain 3 only showed fair agreement. This highlights that there is inherently a complexity of the domains, which is important to do a huge calibration exercise, which we've done thoroughly, including a group of 8 people split into pairs of 2. And we did the agreement between the two assessors evaluated between ROB2 with frequent cycles of meeting and assessing the reliability and comparisons made via ROB1 and ROB2. Next slide. So we incorporated 147 studies in our analysis and had risk of bias assessments for both ROB1 and ROB2. This slide demonstrates the distribution of the overall judgments for the PASI 19 outcome using both tools. As you can see, the ROB2 resulted in fewer studies as being labeled as low risk, and it categorized more as having some concerns. And this clearly sort of depicts the ROB2's greater emphasis on protocol adherence and on the outcome level assessments and detailed signaling questions. Next slide. So as per our discussion per domain, this table shows the agreement per domain, where we can see the Cohen's kappa ranging from 0.33 to 0.65, with the lowest agreement for domain 3 with the missing outcome data. And the flow diagram also illustrates how many studies were changed in categories across the tools. This clearly underlines that ROB2 especially with the protocols where the full subsets are lacking, and the challenges we encountered can be seen as well with the deviations from intended intervention, missing data, and reporting biases without the access to protocols, and the need for extensive calibration and consensus meeting required for frequent review discussions that were required within this exercise. Next slide. So this slide also illustrates the shifts between the judgments between ROB1 and ROB2. For PASI 19, we can see 45% of the studies had different judgment between the tools, including 18 extreme switches with low and high and vice versa. For the serious adverse effect, the switch was even more pronounced, with 60% of judgment that would change, 32 with extreme switches from all between low to high. And this is sort of what we would expect. These changes were mainly because of ROB2 stricter criteria and better recognition for reporting deficiencies. Next slide. So we included studies with a high risk of bias in the network meta-analysis, also known as the NMA, and we found that the impact on the PASI 19 treatment rankings was minimal. The risk ratio was close to 1, and the treatment hierarchy remained largely unchanged. This suggests that while ROB2 may alter judgments, it does not drastically influence conclusion for well-reported efficacy outcomes. Our results demonstrated different picture altogether for the serious adverse effect, including the treatment ranking, which reflects the suboptimal reporting of safety data in trials, and also ROB2's granular and outcome-focused level of focus, flagging more concerns in these safety outcomes. For ROB1, we should have ideally done a per outcome assessment too, but this was not always reported. So for the primary efficacy, outcome was utilized, and these results follow logically, as I've mentioned, for the risk of bias, as the serious adverse effects were much higher, and they weren't taken into account for ROB1's trial due to not being focused on an outcome level and demonstrating ROB2's utility with this safety analysis. So in summary, ROB2 offers an important advantage with clarity in structure, particularly for complex or poorly reported outcomes. Our integrated reliability remains modest, emphasizing the need for training and regular consensus building between raters. For the PASI 90, the impact on the network analysis was minimal. And however, for the SAEs, the ROB2 led to more conservative judgment with greater impact on our conclusion. However, using this utility comes with its own practical challenges, as it's very time and resource intensive with high workload and complexity. And taking all this into account, we still believe ROB2 has shown good value with its careful application to meaningfully influence our review conclusion, especially in regards to safety analyses. Next slide. So with that, I'd sincerely like to thank all my co-authors for the international collaboration. Thank you very much for listening. And I'd like to give special thanks to Professor Laurence Cleach and Dr. Guelimi for the invaluable mentorship and guidance throughout this project.
Thank you very much, Sherry. Thank you very much for your great help on that project. So, as you said, was very intensive. Because we had a lot of trials to assess in a row. So thank you very much, and for your very clear presentation as well. ROB2 is more complex. First, because we have to do it for each outcome. So we have to do twice or more times the job. And it's more complex because before with ROB1, when we were not sure of what to say because it was not really well reported or described, we usually put that it was not reported. But in fact, at the end, a lot of study ended with unclear evaluation, which is not really useful. And now the new tool forced us to take a position saying that that's not reported, but what we think it's good or not. So I think that the tool is quite complicated, but I think better than the first one. Bob,
thank you so much, and thank you for the opportunity.
Thank you. Bob, what are your thoughts about ROB2?
Cherry, are you still there?
Yes.
Yes, indeed.
So just wanted to ask a question. So where do you think it adds most value? So I think you found some advantages. It obviously takes longer. We're generally using Rob2 more than Rob1. Which domains do you think add most value?
So I do think for the safety outcomes, it adds a lot more value. And I think the reason for this sort of domain 1 and domain 2, I do think that this is the case because it's a lot more granular and it's a lot more sort of focused on sort of the outcome level, whereas Rob1 is, it does have a lot of value as well, but it's not quite as granular, doesn't take quite as long with the different components of the domains and sort of going through the